Dear friends, colleagues, and bleeding disorders associates, as a person with hemophilia from Slovenia, I was chosen, perhaps due to my warm personality, to host today two experts from the field of hematology. Ana Boban is the head of Hemophilia Center at the University Hospital Center Zagreb, Croatia, and Associate Professor of Internal Medicine at the School of Medicine of the University of Zagreb. She has specialist degrees in internal medicine and hematology. Dr. Boban's research interests include clinical hemophilia, carriers of hemophilia, von Willebrand disease, etc. Hello Zagreb, Ljubljana calling. Dr. Ana Boban, are you with us?
Hello Ljubljana, Zagreb is here. Thank you Renato for this very nice introduction. I'm looking forward to this virtual interview. I believe that we are going to cover some very interesting hot topics, that our listeners will learn something new, that they will get answers to their questions, and that they will resolve some of their doubts, and I'm looking forward to this meeting.
It is great to have you on board of our modest talk show, Dr. Boban, and let me introduce you our next guest, Professor Dr. Csongor Kis, University of Debrecen, Hungary. He is head of Department of Pediatric Hematology Oncology. Doctor of Science is his scientific degree title, and clinical medicine is the discipline to which his degree belongs. Professor Kis' research interests include pediatric hematology and oncology, regulation of leukemic cells, biological responses, disorders of hemostasis, and disorders of mouth. Iona Podkivanok, Professor Kis, greetings to Debrecen and warmly welcome in the pleasant company of a very kind expert from Croatia and my humble patient perspective.
Hi Anna, hi Renato, good morning everyone. I'm also very glad to be with you together in course of this talk show today, the three of us. It's a little bit pity that we cannot meet in a place like Ljubljana or Zagreb or Debrecen together, but we live in a special times, and this is why we came together to discuss these special times from the respect of patients with bleeding disorders. So I truly hope that we can have some answers for you guys.
Thank you both for participating in a few-minute show about hemophilia and current modern issues. Dr. Boban, I listened to your hemophilia lectures many times in various international meetings. Let me ask you, in the current pandemic of COVID-19, do we patients understand the virus correctly based on your clinical experience?
Thank you, Renato, for that question. I think it's very important because the virus COVID-19 disease is very spread around us, and the information that patients are gathering, they're making their decisions on, are various. And I think it's very important to emphasize where do they take information about the viruses, because we can read about that in the newspapers, on the internet, we can watch it on the television. And the good thing about that is that informations are widely available, so you can read a lot. But on the other hand, we are never sure if this is information or misinformation, because sometimes it's not that easy to distinguish between those two. On the other hand, how the patients are building their opinion about coronavirus is based on their personal experience. And that can be a problem regarding virus, because we know the clinical presentation can differ from very asymptomatic patients to the very severe disease. So if a patient had somebody from the family or friends that had severe disease or maybe even died because of COVID, he will have quite different perspective regarding virus. If, on the other hand, they have been sick with asymptomatic disease or just had the flu for a couple of days, so this can differ greatly. What the patient with the hemophilia needs to know is that they're not prone to get infection and they do not have increased risk of getting severe disease. But on the other hand, if they get severe disease and if there is a need to be placed in the ICU, so intensive care unit, maybe even on the ventilator, it could really gravely have worse prognosis than general population. That is something they should know. Because you heard that there is increased risk of thrombosis regarding COVID. On the other hand, patients with hemophilia are prone to bleeding. And with the medicine, with the factor concentrates, they increase the risk of thrombosis. And sometimes it can be really very, very difficult to balance between thrombosis and bleeding risk in these patients.
Also, bleeding disorders patients have some dilemmas about new vaccines, Professor Kish. From your scientific assessment, could you comment on such ideas from media or individual people? Some vaccine or drug is not worth taking?
Well, actually, all the vaccines against SARS-CoV-2, the new coronavirus, is quite new. We didn't have vaccines directed against coronaviruses before, because coronaviruses actually induced a mild common cold, usually, with the exception of the first SARS epidemics in Eastern Asia and MERS in the Mediterranean and Arabic region. But aside of that, coronavirus, we used to live together until this new variant, the new coronavirus. And certainly the scientific community and also the healthcare industry, the pharma industry, should be able to reply to this challenge of this new virus, this quite deadly virus, by developing vaccines. However, all these vaccines are brand new. Yet I can assure you that the development of new drugs is very strictly regulated. And whenever they hit the market, they have to undergo evidence-based trials. So I think that all the well-investigated vaccines that are available in the European Union and the Northern Hemisphere, they are very well thought and researched and checked out up to a level which can be considered effective and safe.
Dr. Boban, let's take a specific example. Let's say a new vaccine is approved after years of clinical trials. The patient is afraid to take vaccine because he read in the newspaper that some European countries stopped these vaccines. And in addition, his friend had terrible headache because of it. What would you say to the patient in such a case?
Well, thank you. I think that's a very important question that should be answered. So the thing is, we know that all medication has side effects. Even the medication you can buy without a receipt in a drugstore over the counter, they have side effects. And these side effects are really nicely written inside of the box. If you ever read the instructions that you get together with the medicine. And the same is with the vaccine. So every vaccine has its side effects. And during clinical trials, all these data are very carefully gathered and written down. But sometimes some of the side effects happen after the vaccine or medication is out in everyday use. So still there are certain institutions that are gathering these side effects and re-evaluating it again if they're related to vaccines or not. So the top company to do that in Europe is EMA, so European Medical Agency. And I think that we should trust to these experts because they are the top, they are really very thorough in collecting all the side effects. And if these regulators say that drug is or vaccine is safe, I think that we should believe it. And then the other hand, the other part of the problem is to consider whether is a bigger risk of getting side effect or bigger benefit of vaccine or medication. So I think regarding vaccinations regarding COVID, the benefit of vaccination is much greater than potential risk.
Very important opinion. Thank you very much. Professor Kish, how is science really assessing where individual experience ends and where it is really new scientific evidence that justifies changing medicine's risk-benefit profile or making some medicine preferred versus others?
Thank you very much for this important question. This is also a comment to Professor Boban's previous reply. So, the so-called post-marketing pharmacovigilance is as important as the so-called pivotal trials based on which these medicines have been approved and get licensed. Because you see, even if you are not in a hurry, but a normal development of a new drug, you just cannot involve numberless patients in a clinical trial, not even in a well-designed randomized clinical trial, not to speak about that you want to study homogeneous groups. Usually healthy persons when we come down to vaccines or otherwise healthy persons. So certain subgroups of patients cannot be investigated in those previous trials. So therefore, always some new aspects may emerge, and these new aspects should be very carefully studied in post-market vigilance investigations.
What is your opinion about individuals who publicly refuse vaccination and in this way can make a strong influence on people who are still undecided? What do you think?
Well, I think anyone is entitled to have an opinion and to express her or his opinion. However, I think it's very dangerous to tell such things that would prevent anyone from getting a vaccine when vaccine can prevent or can diminish the consequences of a severe disease. Not to speak about the public health aspects that probably this pandemic cannot get stopped unless we have a decent vaccination of the, I wouldn't say entire population, but a whole lot of the population, a substantial ratio of the population.
Yes, Dr. Boban, do you share the same opinion as Professor Kish?
Yes, I completely agree with Professor Kish, because we know that each person can decide whether he wants to be treated or not. And the same is for the vaccination, if you want to be vaccinated or not. But think about vaccination is not just protecting yourself, but protecting others. The point that Professor Kish very nicely taken, that the pandemic won't stop unless we got vaccinated, the majority of population. And regarding that, I think that should be stressed, that vaccination is not only affecting yourself, but affecting people around you.
From my patient perspective view, I am really interested in your experiences on hemophilia patients who got sick from the COVID-19 in your countries. What were, let's say, their most severe consequences?
So, fortunately, I didn't have in Croatia any patients with hemophilia and severe COVID disease. So we have some patients that got infected, but only minority get to hospitalization. But fortunately, there was no one who needed admission to the intensive care unit or ventilator. So all the clinical presentations were mild. All the patients continue with the previous prophylactic treatment, and there was no signs of any thrombosis or bleeding in these patients.
And Professor Kish, your experience from Hungary?
Well, actually, as you introduced me, I'm a pediatric hematologist. So usually COVID is less severe among kids than among adults. So fortunately, our patients here in Debrecen living with hemophilia, they escaped coronavirus infections so far. We have some other hematologic patients with malignant hematological disorders, with solid tumors, with ITP, immune thrombocytopenia, autoimmune hemolytic anemia, who got the COVID. But fortunately, it was not more severe than in any other cases with respect of children. I also asked my colleagues nationwide in Hungary, and as far as we know, we didn't have very severe cases, fortunately, among patients with hemophilia and acquiring the COVID.
So let's conclude our conversation with a very simple question. Would you recommend vaccination against COVID-19 to your hemophilia patients and people with hemophilia in general?
Of course, I would strongly say that patients with hemophilia should be vaccinated, and I would like to say that they shouldn't be afraid. Vaccination against COVID is the first intramuscular vaccination in patients with hemophilia, which means that they will get a needle inside the muscle. And of course, that raises a concern about having a hematoma in the place of vaccination. That's why we have really nicely written precise guidelines regarding the level of factor activity prior to vaccination, and the finest needles should be used, and together with that, there is no risk of increased hematoma or any side effects for the vaccination. Yeah, so I would strongly suggest to all patients with hemophilia to get vaccinated against COVID-19.
And what about your recommendations, Professor Kish?
Definitely, I would say so, because the vaccines have a reasonable efficacy and safety profile, whereas coronavirus, the new type coronavirus, does not have such. So it may turn a very nasty disease in contrast to vaccines. Besides, as Professor Boban pointed out, that the volume of these vaccines changes between 0.3 to 0.5 milliliters. So this is such a tiny volume that it can be applied reasonably safely, even to a patient who lives with a bleeding disorder. So there were, so far as I know, as a pediatric hematologist, I didn't vaccinate my patients with hemophilia against COVID or something else intramuscularly, but as far as I know from the Hungarian adult hematologist colleagues, they didn't have any problems by vaccinating patients with hemophilia.
I have an additional question. We discuss a lot about vaccines, but what about medicines? Do you think same principles of assessing medicines profiles apply to medicines?
Yes, I think they do. In a way, vaccines are also medications, and they're going through the same pathway of production and the clinical trials and post-marketing vigilance, same as medicines. Now we have lots of patients vaccinated in a short time, and that's why I think the vaccination is now a hot topic. But for the rest of the medication, the same rules apply and same guidelines should be used.
And Professor Kish?
Well, actually, the principles are certainly much the same. However, you need to consider that special groups of medicine, special groups of patients need to be taken differentially. For example, if we come down to patients living with hemophilia and products against hemophilia, then usually we cannot apply a placebo-controlled randomized clinical trial, because we know that living with a severe form of hemophilia is dangerous. So we are not entitled, ethically not entitled, for example, to apply like plain water as a placebo against a potentially effective factor concentrate or whatever.
Perfect conclusion, dear guests. I would like to thank you from the bottom of my heart for your outstanding conversation and open opinions about the virus to which we are not immune even in our hemophilic community around the world, and which ends with the infamous name 19.
I would like to thank all. I think this was very nice virtual interview. So I hope our next interview won't be virtual, will be live, face-to-face, and I hope that in the future there will be no need to talk about COVID-19 anymore.
Yes, I truly hope also that in course of our next interview we can discuss how we fought COVID also among patients with bleeding disorders, and we can focus on novel issues like quality of life for people living with bleeding disorders.
I understood my guests that it is very important not to make fast conclusions on the basis of individual assessments from media, politicians, and non-experts. Please use available support in informational sources such as healthcare professionals, guidelines from World Federation of Hemophilia and European Hemophilia Consortium, international societies, European Medical Agency, and national institutes for public health. Goodbye.
Thank you and goodbye.
Thank you very much. I was very happy to be with you, and goodbye.